Good afternoon, everyone. I'm Dr. Aparajitha Bondili. I'm here to present a study on etiology of acute loss of vision in patients presenting to the Neuro-ophthalmology department at a tertiary eye care center. Acute vision loss in neuro-ophthalmology is a significant and often an alarming clinical symptom with profound implications of both diagnosis and management. Now, it encompasses a wide array of pathologies necessitating a nuanced approach of diagnosis and management. Neuro-ophthalmology department specializing in disorders where neurological and ophthalmic issues intersect is pivotal in the evaluation of these complex cases. So my study is retrospective. The purpose is to analyze the causes of acute loss of vision in patients presenting to the neuro-ophthalmology department at our tertiary eye care center. To provide comprehensive overview of contributing factors, methods, we analyze the hospital data from a tertiary eye hospital within a time span of 6 months, spanning from July 2023 to December 2023. The results were, out of a total of 5,799 patients coming to the neuro-ophthalmology OPD in a time period of 6 months, patients with acute vision loss were 787 with a percentage of 13.57 and average age of presentation being 49 years. The diagnosis included were non-arthritic anterior ischemic optic neuropathy, optic neuritis, traumatic optic neuropathy, toxic optic neuropathy, cortical blindness, orbital apex syndrome, LHON, peripheral vision loss which includes field defects, and arthritic anterior ischemic optic neuropathy. The percentage distribution of the diagnosis were as follows. As you can see, NAION had the most common presentation with 33.5%. Being the most common presentation, we evaluated the comorbidities as well. Diabetes being the most common comorbidity with 66.67%, followed by hypertension at 42.04%, followed by hyperlipidemia and cardiac diseases. The mean age of acute vision loss was found to be around 48.9 years, with LHON being presented at 27 years. So the discussion, average age of presentation was around 49 years, with NAION being the most common diagnosis at 33.5%. This is in alignment with results obtained by Lensworth et al., where NAION showed the highest percentage of in patients with acute optic neuropathy. The systemic associations were diabetes, followed by hypertension and hyperlipidemia. Optic neuritis is the second most prevalent diagnosis. It was commonly seen in patients in the 4th decade. Traumatic optic neuropathy was the third most prevalent disease, with 19.4% patients diagnosed with it. In contrast to other causes of acute loss of vision, the average age of presentation of LHON is in the 2nd decade of life. Notably, AION was not reported in any of the 787 patients. The take-home message of my study is that NAION was the most common diagnosis, with the most prevalent comorbidity being diabetes followed by hypertension. Diabetes and hypertension management is key in reducing risk and progression of NAION. Coming to traumatic optic neuropathy, it accounts for 19.4% of cases. The use of protective headgear can significantly reduce its incidence, and AION was not reported in the study population of 787 patients, suggesting it may be a rare in this group. These are my references. Thank you.